So good afternoon. Good afternoon and welcome to Allergy and Asthma Network's third session of United Let's Talk About. I am Mary Hart, Allergy and Asthma Network's Director of Research, and I'm setting in today as moderator for Tanya Winters, our President and CEO. This first slide shows instructions for those who want to listen in Spanish and where to access the interpreter. You may also want to mute the sound to the original language session as you listen to Spanish. So we are happy to have our interpreter, Sonia Roman, joining us today. Go ahead and take it to the next slide, please. So we at Allergy and Asthma Network, we're very excited about the opportunity to offer this series of conversations with the Hispanic Latino community from a Eugene Washington Engagement Award from PCORI. This session will focus on my lungs, my asthma, and my journey. Next slide, please. And our agenda today, welcoming you all. We'll have a Combat COVID-19 initiative, a patient panel discussion, those living with asthma, COVID, and the questions that they want answered. And then we'll have a Q&A session. So things we're going to cover today, we have an expert from Combat COVID, Katya Corado. She will discuss the impact of COVID and how its impact on the Hispanic and Latino community and where to access more Combat COVID information online. And then Dr. Judith Flores will lead a patient panel discussion as they share their experiences with asthma and or COVID-19 and the questions they want answered. So our objectives are to describe the Combat COVID initiative, discuss the benefits of the COVID vaccine, and explain why diversity is needed in clinical trials. And I just want to also share with you that this program is being recorded and it will be posted on our website for anyone who misses the session to review later. It has not been approved for any CEUs, and handouts for the session will also be available. And at the end, please complete the post-survey evaluation once the session is over and help us improve on our future sessions. So at this time, please join me in welcoming our speakers and patient panelists. First, we have Dr. Katya Corado. She's from Harbor UCLA Medical Center in Los Angeles, California, and she is speaking on behalf of Combat COVID. And then Dr. Judith Flores is from New York, a pediatrician and vaccination team lead for the New York City Test and Trace Corps. And she's also the past chairwoman for the National Hispanic Medical Association. And so please welcome our patient panelists who happen to also be patient advisors for this engagement award. First, we have Alex Pilon Moya. He's an asthma patient. And then Angel Melendez, who is also an asthma patient. And then Megan Carrion, who has a child with asthma. And then last but not least is Dr. Pastor De La Rosa, who has survived COVID and a lung transplant. So they're all going to share their real world experiences of living with asthma, COVID, and their insight for participating in research and why they participated in this particular project with us. So let's get started now with our first speaker, Dr. Katya Corado, and she will present on the Combat COVID.
Thank you so much, Mary. I am incredibly honored to be here speaking to everyone today, and I hope we get a chance to interact a little bit with the questions that people have. So my name is Katya. I'm an infectious disease physician, and obviously during COVID, it has been just a whirlwind of learning, of teaching, of treating patients. And so I want to share some of that with you. I am not affiliated with the United States Department of Health and Human Services, and everything that I express in this talk is my own view. So please, next slide. So let's talk a little bit specifically to our audience today about what the COVID-19 impact is on the Latino community, of which I am part of. Next slide, please. So we know that 17% of the US population is Latino or Hispanic, yet 27% of COVID deaths in the US are among Hispanics or Latinos. So just kind of think about that. Even though we make up a smaller percentage of the US population, we make up over 1/4% of the deaths in this country. So Latinos have a higher risk of infection. They have a higher risk of having serious symptoms and death compared to whites. Anywhere between 2 and 3 times the risk for infection, hospitalization, and death. And the higher risk, there's many reasons why that's the case, but there are reasons such as having pre-existing conditions. So for example, asthma being one of them, diabetes, high blood pressure, heart disease. These are conditions that we know cause a patient to have a worse outcome with COVID-19. And within our own communities, sometimes our own communities don't know we're suffering from diabetes, asthma, high blood pressure. So also having poor access to healthcare. We understand that we come from varied backgrounds. I see some people from Puerto Rico on the chat, which is so wonderful. So the different ability to be able to access good preventive care, clinic care before they have to get to the ER makes tons of difference. And in some communities, we have lower vaccination rates. Next slide, please. So let's talk specifically about what happens in the asthma population. So people with non-allergic asthma have a higher risk of serious COVID-19 complications and symptoms as those compared with allergic asthma. Okay, so we made this group specifically probably understands the difference between allergy-induced asthma and the other type. Next slide, please. So let me pause here and Mary is going to take over for a sec.
Yeah, so we've included some polling questions to get our audience engaged today. So we'll take about 45 seconds. I want you all to read this and answer it. And then we will have the answers at the end so we can see where our audience stands with this. So the question is, people with asthma are more likely to be infected and hospitalized with COVID. True or false? And answer it. In just a few seconds, we'll have. So Linda, do we have the results yet? Oh, true. So we might want to talk a little bit more about that in this discussion. Thank you all for participating in that.
Next slide, please. Let's address the answer. So patients with asthma are not more likely to be infected or hospitalized with COVID-19 than people without asthma, okay? However, the symptoms of asthma patients exclusively can be more serious. So that's very interesting and a little bit different of what we normally think of asthma patients with respiratory illnesses. I think what people should realize is that COVID-19 is basically a different beast. And those of us who have issues with lungs and those of us who don't have issues with lungs are equally at risk of having problems with it. Next slide, please. So let's talk a little bit more about how COVID-19 has affected our own communities. We know that I touched a little bit about how our community of Latinos, Hispanics are more likely to be infected, hospitalized, and die. So in order to combat this, right, we need to know several things. Number one, we really need to know the facts about COVID-19. And while this is kind of simple to say, sometimes it's not as simple to realize where your facts are coming from. So I think we've all have our eyes opened in the last, 4 to 5 years about understanding that it's very important that we know where we're getting our information. Due to the massive amount of information that you can find in social media or on the internet, sometimes we just don't know where to go. We need to know this because we have to make informed decisions about our health care. So when we don't know, we act out of fear, we act out of concern, we act out of unfortunately, in a place where we don't know things. And when we are trying to make decisions for ourselves, whether we get vaccinated, whether we put ourselves in a clinical trial, whether we accept treatments that are under emergency use authorization by the FDA, we need to figure out what that means. So a place where we think that you can go to that we trust is basically our website. So it's both in English and in Spanish. And the next slide, I believe, has the websites on. Nope, I'm lying to you. Sorry. So combatcovid.hhs.gov is the website, and combatecovid.hhs.gov, so both English and Spanish, are available. And what Combat COVID is basically a national education an outreach initiative developed by the Department of Health and Human Services in conjunction with the National Institutes of Health, so that we can get our communities to know about COVID, to know about clinical trials, to know about vaccines, to know about treatment. And it's a one-stop shop where people can go for information of COVID, which is ever changing. I believe the next slide should contain nope, see, I don't know where the website is. It'll come up eventually. So again, our website, which is done in conjunction with the CDC and the NIH and the Department of Health and Human Services, is a great place to go to make sure that you have the latest COVID-19 updates, latest vaccine information, treatment options, clinical trials, and other resources. We know in the last 2 years, information has changed very quickly as we get more data about how COVID works, what the treatments are, what the vaccines do. This place is where you can go and trust that the information is true and correct. Next slide. So please go to our Combat COVID website. And I think this is just a little slide to show you what it actually looks like. Next slide, please. Okay, let's transition. Oh, yeah, so the website name is combatcovid.hhs.gov or Combate COVID, so combate in Spanish, combatecovid.hhs.gov. Let's talk a little bit about COVID-19 vaccinations, because I think people still have a lot of questions about them. Next slide, please. All right. So what I want to make sure that the entire audience is aware is, like, what are vaccines and what do we use them for? So vaccines are used to prepare your body to fight an infection that hopefully it hasn't seen yet, right? So for example, if I am trying to fight, say, an influenza, the flu virus, and I have never seen the flu virus before, I get infected, my body has to find out what I'm infected with, how to fight it, how to create a response to it, and then attack it. That takes time. And in that time, our body is very vulnerable. So what vaccines do is they skip that time. They get your body ready to basically fight the infection as soon as you see it. So again, for example, for the flu, I got my flu shot this year. I hope you did as well. So now my body has created a memory of the flu virus. And so if I were to see it, if I were to be exposed to it, my body can jump several steps and say, aha, I know what I need to do because I've seen this before, right? I have a memory of this and I can attack it. So that's what vaccines do. In terms of COVID-19, vaccines can actually prevent the development of COVID-19. And we have been very amazed about how good our vaccines work. So I hope people know that in general, so the flu vaccines at best are maybe 60 to 70% effective. COVID-19 vaccines are in the high 90s. That's unheard of. It also reduces the spread of COVID-19 to others. So what does that mean? So I'm going to give you two scenarios. So I am Katya, I am unvaccinated, I get COVID-19. The amount of virus that I will have in my nose and my pharynx will be very high. And when the virus number is very high, it's very easy for me to send that virus to others. But say it's me, right? Katya gets vaccinated, and then I happen to be infected with COVID. The amount of virus in my system will be much lower as compared to my unvaccinated self. And so I will be less likely to give my virus to someone else because I have less of it. So when you vaccinate yourself, you're also protecting those around you, even if you do get infected. They also reduce the symptoms of COVID-19. And what we really want, obviously, is for the vaccines to prevent hospitalizations and prevent death, right? It would be great if 100% of the vaccine prevented infection, but what we're really looking for is that if you were to get infected, that you won't die or have bad consequences of the disease. And it really helps, especially now when we have variants. So variants are viruses that go through different mutations that sometimes allow it to, say, replicate better, sometimes allow it to be a little bit more deadly, sometimes allow it to escape certain treatments that we have. Next slide, please. As with many things, there's also sometimes a little bit of misunderstanding or myths or misconceptions about vaccines. I want you to know that the vaccines are safe and effective. How can I know? I know because I am part of the people who do the clinical trials to make sure that the vaccines are going through their phases, their preclinical phase, their phase 1, their phase 2, their phase 3 clinical trials, so that we can make sure that the vaccine is safe and effective way before we go to the FDA and say, FDA, this is our vaccine. This is the data we have. This is what it shows. It shows a reduction of, a protection of 95%. We believe we can move forward with this. Nothing that you get, no medications, not even baby aspirin or inhalers, you can't get them unless they go through the same process, and the vaccine did that as well. It comes from highest manufacturing quality. What's really important about the vaccine is that this is not a vaccine that gives you the virus. So there are some live virus vaccines that people can get. So for example, yellow fever vaccine, typhoid vaccine, those are vaccines created with basically like a weaker version of that infection, and it's given to your body. The COVID-19 vaccines do not. They don't contain any live virus. You cannot get infected or infect others with the COVID-19 vaccine. And it definitely does not change your DNA. So I know there's a lot of fear with the mRNA vaccines, right? The Pfizer, the Modernas, and some people are nervous that it's going to change their DNAs. That's not how it works. What mRNAs are, they are basically it's basically a messenger that tells your cells how to create the spike protein. And we have heard about spike protein in COVID because we need the spike protein. So say this is my virus, this is the spike protein. I need the spike protein to basically be able to connect to my own cell so that the virus can enter my cell. Without the spike protein, the COVID-19 can't work. And so when when my body is reacting to the COVID-19 virus, it's reacting to the spike protein. And all the mRNA does is it tells your body how to create the spike protein so that your own body can make a response to it. It's really a brilliant, brilliant way to boost your immune system. Not an experiment, right? So as I said, we go through the clinical phases. More than 30,000 people were investigated during each of the COVID vaccines. And so we have many people who have gone through the clinical trials. And now we know that the vaccines work, so it's not an experiment. And it definitely does not affect your fertility. So if you're worried about getting pregnant, or if you're pregnant right now and you haven't been vaccinated, I highly encourage you to think about it, because when you protect your body, you actually protect your baby as well. Next slide, please. Let's talk a little bit about COVID treatments. And Mary, if you can let me know, I'm going over to, oh, here we go. Okay.
Right on time there. So this is our polling question 2. Please, all of you answer it. I have been treated for COVID with monoclonal antibodies. You can answer yes, no, or I don't know. Take a few seconds and answer, and then we'll have the results here, and we'll continue the conversation about treatments. And I might add while we're doing this as well, that if you have any questions, be sure and put them in the Q&A on the format there. We'll have time for that at the very end of the session. Okay, so no has 61%, 28%. It'd be interesting to find out the results of how people, how well that worked for them. And then I don't know. And I was one of those I don't knows when I had COVID. So let's go ahead and close that out, and we'll talk a little bit more about this.
Thank you, Mary. So let me spend just a couple of minutes telling everyone what monoclonal antibodies are and how it's used as treatment. When you leave today, I want you to feel very confident in knowing how they work. It's not, it's not a mystery, it's not magic. So when I was talking a little bit before about that spike protein, right? I told you that the spike protein that sits on top of the COVID-19 virus cell, that spike protein connects with your own cell in order to enter it and then replicate and cause damage. So if there is a way that I can stop that spike protein from connecting with my cell, that is a way I stop the virus from entering my cell and causing problems. That is what monoclonal antibodies do. So you have the COVID-19 virus, you have the spike protein. I give you monoclonal antibodies, and what they do is they come into your body and they find the spike protein and they basically cap it. When they cap it or they cover it, they don't allow the spike protein to then connect to your own cell, and therefore it stops the cycle. So it's extremely important for this therapy, for this treatment, to be given when the virus is active in your body. Because if I give you the treatment a month after you have COVID, you no longer have the virus being active in your body. You may still be having the consequences of having that virus, but the virus is not active in your body. So within the first 10 days of infection, within the first 10 days of having symptoms, that is when these medications work, because that's when your virus is active and it's finding cells to destroy. So monoclonal antibodies are basically that. They cap the spike protein so that it stops that virus from entering your own cells and causing damage. They are given, and I guess about 30% of you have received this, they're given for people who have tested positive for COVID-19, who have symptoms of COVID-19, but are not sick enough to be hospitalized, right? So this is everything outpatient. This is what we're trying to get you. And the reason to get monoclonals is because it prevents you, or we hope, not we hope, we know it prevents you, which is why we give it. It prevents the bad consequences of having to be hospitalized and dying of COVID-19. Next slide, please. So let's move on just a little bit about research for COVID-19. And this is where I hope I get a lot of questions. I hope that those on the webinar are a little familiar with why research, why clinical trials are important. You may even have participated in some yourself. In order for us to find if a new medication, a new treatment, a new vaccine works, we have to make sure, number one, that it's safe, number two, that it's effective, and that it's effective in the people that we want it to work in. So in order to do that, it's not like I can just, if I go to my backyard and I pick a flower and I say, you know what, this flower is going to cure your asthma, and I give this flower to you. What I hope you do, I hope you say, Dr. Corado, show me the evidence that you have studied this flower and that it's safe for me to ingest, that it's going to work on what you think it's going to work on, and I'll be fine. So that is what I need to do as a clinician researcher, is to make sure that the product that I'm evaluating is going through clinical trials so that I can then, when I find my results, I can turn around to you, my patient, and say, okay, I've studied this. We've studied this in 30,000 people. We know these are the side effects. We know this is what to expect with the treatment. And that's what clinical trials are. The active 2 clinical trials, that's where I'm coming from, is looking at different treatment options for COVID. It actually is looking at people who have COVID and are not hospitalized. It's looking at people who have COVID and are hospitalized. And those are 2 different sets of folks. And it's even looking at people who have been hospitalized with COVID and then discharged from the hospital. So we have the entire breadth of the clinical presentation. Next slide, please. Okay, and this is what affects us mostly as Latinos. So let me go back to an example. I have a vaccine that I think will help prevent COVID, okay? In my trial, I enroll 100 people, but I enroll only white men, okay? And in this 100 people, 100 white men take this vaccine. I find that it works really well. Perfect, that's great. Now, I have to turn around and talk to my 65-year-old Latina, to my 40-year-old Black woman, and let them know, oh, I think that this vaccine that I only studied in white men will have the same effect in your population. I can't do that with confidence. Unfortunately, I am forced to do that when we are unable to get a good representation of our communities in these clinical trials. So when I say, you know what, the COVID vaccines, 30% of people enrolled in the clinical trials were Latinos. So I'm pretty confident that your community, your mom, my grandparents will respond in the way that I expected to respond. I feel much more confident in saying that when we are active in the clinical trials. So as we know, COVID has devastated our communities. And so in terms of vaccines and treatments, we have to have data, and good data, that show that the medications and the treatments work in our communities. Next slide, please. And I think this is my last slide. Again, this is the website, combatcovid.hhs.gov, combate COVID in Espanol, hhs.gov. You can follow us on social media. I don't know social media very well, but we have a whole crew that does. And please, 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 if you do anything, is share this information with your loved ones who also may be struggling with where to find information that they can trust. Next slide, please. I think that's the end. Okay, And here's some of my references for what I've discussed. Mary, I'll turn it back over to you.
Well, actually, I'm going to kind of go off if we want to call it script, but I have a couple of really good questions, and then we'll get to the polling questions. But while I have you here, I mean, that was very impressive, and lots of people, there's lots of chatter out there about how informative it is. But there was a question about, it says, I'm pregnant. Is it safe to get the second dose while I'm pregnant? I thought that might be an easy one for you to answer.
Oh, Mary, that is such an important question. And thank you, the person who asked it. So clearly, we understand that when you are pregnant, you are not only worried about your body, but you're worried about your baby, right? And so we know that's the case. We applaud that you're worried and want to do things that are safe for your body. What we do know is that the COVID-19 vaccines, really any of them, but the COVID-19 vaccines, they are safe to give in pregnancy. In fact, women that are pregnant that don't get the COVID vaccine, that end up getting COVID, have a worse outcome when it comes to fighting the disease. I unfortunately have had to be present in the hospital admitting young women who were otherwise healthy, but that are pregnant, that did not go well for neither baby nor mom in their COVID battle. So when you get your booster or when you get your second dose while pregnant, you're actually protecting your baby. Okay, so I would highly encourage you to speak with your OB-GYN and get yourself vaccinated.
Great, thank you for that answer. I have one more I want to ask because I felt like it was important to ask at this time. Is a prescription needed for the monoclonal antibodies?
That's a wonderful question. A prescription is not needed. Here is the hard part. The hard part is finding a center that will give it to you. So the monoclonals, those of you who have received it, you know this, it's an infusion that you get. So you have to go to a place, get your IV done, get your hour-long infusion, wait for an hour long afterwards to make sure that you're not going to have a reaction, and then you're allowed to go home. So it has been logistically very difficult to set up these clinic sites all over the country. And unfortunately, okay, and this is serious talk, unfortunately, the wealthier communities have had more access to the monoclonals than the communities that we serve. So I am extremely proud that at Harbor, that the community that I serve, we do provide the monoclonals and we are able to get patients in. It's free of charge, you know, and all that. So if you get infected, the very first phone call to you is to your provider. If they can't access a monoclonal site, this website, the combatcovid.hhs.gov, can also give you good information of how to get treated or enroll in one of the trials for treatment. Oh, there we go. Yeah, monoclonal call center. That's perfect.
Yes. Okay. And then one more, and then I'm going to go into the polling question. But do the vaccines protect against variants with this latest variant, the Omicron variant?
Oh gosh, so such wonderful question and such up-to-date questions. And so the Omicron variant is still very new in the scientific community, and we have to run a lot more tests to see how protective the vaccines are. What we do know from past experience with past variants, anywhere from the Alpha to the Delta, which there's been many variants, we know that the vaccines afford good protection in spite of the mutations that the COVID vaccine gives. Will it be at 95%? Maybe not. Will it be 80 or 75%? Probably, but that is much better than 0%. So if you're on the fence of getting vaccinated because you kind of want to wait to see if a new variant comes out or a new version of Pfizer or Moderna comes out, I would say you're running the risk of getting infected now. So please get yourself vaccinated and protected now, and then we'll deal with what comes later.
Thank you, Dr. Katya. Let's go ahead and move on now to our polling question. And this is number 3. I think we have one more after this. But this one says, I have not had the COVID vaccine, but after hearing this presentation, I plan to get it. Yes, no, or I am already vaccinated. I'll give you a few seconds to answer that. It'll be interesting to see what the results are, because in our first session, when we asked, most people had been vaccinated in that session. So it will be interesting. Let's go ahead and see the results now, Linda. Okay, so we're about, yes, that's great. So thank you, Dr. Katya, for the information you provided. It seems like you've changed some minds there. Okay, let's go ahead and go to our last polling question. Again, thank you all for participating in these. It really does help us and guide us in some of the things that we'll need to share with you later on educationally. So this one says, I have already had the COVID vaccine, but after hearing this presentation, I plan to get my booster. Yes, no, I'm not vaccinated, or I'm not ready to get a booster because of personal reasons. Okay, I think that most everyone has probably had a chance to.
Mary, I'm not, for some reason, the poll isn't allowing responses. So let me stop the poll and I'll try starting it again. Well, for some reason, it just wouldn't work and I can't restart it. I apologize.
All right, we have lost contact with Mary at this moment in time. My name is Dee Dee Gardner. I'm the Director of Research and Evaluation. We are going to punt kick at this moment in time. Going to go ahead and introduce Dr. Judith Flores.
She's actually back, I think. Well, I just want to start off by thanking Dr. Corado very, very much. I thought her presentation was excellent and engaging. I do quite a few of these, and many times people miss the boat by giving information that doesn't really bring people in. But I thought, Dr. Corado, you did a marvelous job. And I was sitting here listening and taking some tips for my next presentation. So muchísimas gracias, it was very good. I want to start off by just, you have on the screen the guest patient speakers and the project advisory group that will be getting some of the questions for today. And I do want to start with what I'm going to try to do is ask questions directly to certain people so that we can move the agenda a little bit faster. So my first question is really looking at the experience of living with both asthma, lung disease, and COVID. And so I wanted to ask someone what their experience had been with being infected and also having asthma. And also I wanted to ask them what their experience has been with the vaccination. So I want to start off with Pastor Dot de la Rosa, because I know that she has some information she can possibly share with us.
Yes, hello, thank you so much.
You're welcome.
What question did you want me to answer
Yours
first?
in particular is, I believe that what I want to do is see if what has been your experience with both COVID and asthma, having both. And
I don't have
that experience.
I've never had asthma, but I have had lung disease and I have had COVID.
Yeah.
During my time when I was infected with COVID, I started thinking about it, and I guess I have to go back and think the first thing was probably, well, was the isolation. The isolation was the absolute worst. And of course, that's tied with losing my mother. I lost my mother, unfortunately, to COVID, and I lost my aunt. And then the diarrhea was horrible. It seems like I had diarrhea for like 3 weeks. And then I wasn't able to inhale or exhale. I have a interstitial lung disease, but even this is no comparison to what my lung disease was. But isolation, death are just the worst. But I'm so grateful that, I've been able to recover. Obviously, I'm here now. But those are some of the things that, I was traumatizing me completely. Of course, being in the hospital, as well. That isolation again, I was hospitalized the day after my mom had just passed. So all of those things were just the absolute worst.
So I want to thank you for sharing that. That was unfortunately the experience of a lot of people, especially the isolation and the toll it has taken, and it's taking now on many people. That's one of the consequences of COVID. And it's interesting that you said that even with your progressive and with your lung disease, having COVID was much more severe and much more difficult. So I want to move to a second panelist, and I want to pick up on the issue of isolation and the issue of how we were impacted with our mental health, our own personal mental health, and that of our children in this period of the pandemic. And I want to go to Megan Llamas Carreon, because I know she's a parent of a child, and I know that we've seen a lot of impact with children around this period. So Megan, I wonder if you could share something about what your child had gone through, or what you've gone through with your child being home and also having asthma during this pandemic.
No, absolutely. I think it's really important just for everybody to know in these instances, a lot of people are parents at home with these children and they feel alone in it. And it's something that everybody's going through. My son in particular, he's currently 7 years old, but I mean, since he was born, he's struggled with breathing issues, struggled with asthma, especially seasonal asthma. And we're usually in and out of the hospital, I would say 3 times, sometimes 4 times a year. And those are emergent visits because he was originally given albuterol, which is just a breathing medication that I'm sure many of you that have children or have asthma yourself know that that's the go-to. So most of you guys will recognize that one. And he was having to use that every day, every morning, every night. His school had to use it. And as a parent, I was concerned because we were having to get up and go to the hospital. And I wanted to share one particular story with you guys, just because I know it's probably the scariest moments that we deal with children with asthma. Is my husband was deployed, and this is during the pandemic. My husband was deployed. My son comes to me because he's been dealing with this forever. He knows. He comes to me at like 2 a.m. and he says, I can't breathe, but he's talking in spaces, right? I can't breathe. And so I could hear him. I immediately jump up. I get him going on back-to-back medications just because we had nothing else. My husband, I called him, I FaceTimed him. Luckily, we had that option. While I got my daughters together to get in the car, he's talking to him, making sure he's keeping the medication in his mouth and he's breathing. We raced him to the hospital. I was in between calling an ambulance or going myself. But I have a plug in my car, so I chose to go myself. That was an option I chose to do. And I got to the hospital and they told me if I'd gotten there any later, they would have had to, it's called a trach, but they just put a hole in the throat so they can breathe for him. Some of you guys might not know what that is, but it's scary as a parent just going through those moments. Luckily, he was fine. They got his airways to open up and he was good. But it's something we struggle with all the time. But I actually changed PCPs, like his physician, in order to get him better managed. And now he is on a daily medication. And we have not, crossing my fingers, had an incident in probably 6 months now. And so we're super happy for him. And he's happy, and it's so funny because once we got his asthma managed, it seriously was like he has all this energy. And I'm curious to know, is it really like all this energy he never had, or was it energy he couldn't exert because he couldn't breathe? Like,
Yeah.
I wonder, I don't know. But we also recently, because of his asthma, and I've always kept him in a bubble just because I was really scared, right? It's just what we just talked about that I found interesting in our speeches. Asthmatics are going to get COVID more than somebody else. And it's not true, but in the beginning, we didn't know. And I was genuinely scared. I kept him in a bubble. I was really nervous.
Yeah.
And then once the vaccine came out for him, I actually just got him vaccinated. It's a very hard decision to make. I know everybody's worried about their kids. I know. But we decided to go ahead and get him vaccinated. And tomorrow is his second vaccination. And he's been handling it really well. We haven't seen any bad side effects, anything relating to his breathing, nothing. He hasn't had any side effects. So we're super excited for him. And he's excited. He walked around, oh, I got my vaccine. And I'm like, yes, you did.
This is a very good story that you're sharing with us. And as a pediatrician, I just buy into the whole thing because I see this all the time, especially because I work a lot with children with asthma. But during that period, we had a lot of difficulty getting people into the hospital to even get their medications. It was very frightening. Just one more thing, could you share how you were able, what made you make that decision to vaccinate?
So being completely honest, our daughters, we knew we wanted to, because I have 2 older girls who are 12. We knew we wanted to get them vaccinated, but we were leery. My husband and I were both already vaccinated. We got vaccinated when we were able to. But just like all the other parents out there, I was nervous. I was just like, okay, these are my kids. Like, I'm not sure. But I also believe in science, and I believe in what's behind it, and I trust it. And my girls wanted to get vaccinated too. They were just like, we want to feel safer. We want to feel more comfortable, So we said, okay, let's do it. So we got the girls vaccinated, and it was literally like 2 days later that they opened it up for Michael's age. And then, so then he wanted it. And we were like, you know what? Like, I still kind of bubble him. And I was like, I just want to feel more comfortable and at ease. And I am like, it just kind of sets your mind at ease, knowing he has some sort of protection. And that's kind of what I needed, because you mentioned mental health, and it drives me crazy. It really does, because I'm always worried. I'm concerned. There's nights where I would just kind of sit up and listen to him breathing to make sure it didn't sound like it was going to go south,
Yeah.
And it was just the ease of mind, and then his positivity about it. I was just like, this is it. We just need to do it, because their mental health is important, but so is ours as parents. You can't take care of them if you're not taking care of yourself. And so it really helped, and just seeing him like run and not have all these issues is amazing.
So thanks a lot. You're really opening up what a lot of people share, especially their decision to vaccinate. And it was a courageous one and a good one. And I would say about the mental health things, that one of the things that we're doing now is really exploring how children feel about vaccinating. What is asking them is not a bad thing to find out. And one of the things that has come up is that children want to get vaccinated because they want their parents not to be afraid. They want to reduce the stress in their parents. So I want to move on to a question about the experience of being a patient advisor. So Angel Melendez, I really want to kind of involve you, because I know you've been extremely active in getting information out and in your unique way. So if you could share a little bit about your experience in being a patient advisor, and also in your experience talking to people about possibly being involved in clinical trials. That's for Angel.
Yes, hello.
Hi.
So for my experience being a patient advisor, I really wanted to get into it because I felt like there was a lot of underrepresentation in minority groups, and we needed to get more people involved so we can better understand conditions, treatments, therapies. One of the biggest factors here in the city I live in is we have a large Hispanic population, but a lot of our treatments and therapies were more cookie cutter at the time. Over time, over years, more patients came in. They were part of research, they were part of studies, and therapies and treatments were able to be changed. In the Hispanic community, the food we eat, even the fragrances that we use are not always very common. And growing up in a Hispanic household myself, I was exposed to a lot of different foods and fragrances that were a trigger for me, but weren't known asthma triggers. So once we started getting more patients involved, more younger patients, older patients, more of a diversity when it comes to different ethnicities and backgrounds, it was more possible to see, oh, well, we're seeing a trend in this patient group. We need more research to see, all right, what can this food do? How can this food irritate patients? How could it irritate airways? And another big factor about being a patient advisor is that I found that a lot of times people don't feel like they have enough information, and either they are shy to ask their doctors or they don't know what to ask their doctors. For example, when it comes to asthma patients, not everyone knows about how to use a spacer. Not everyone knows how to take their medications properly. And some of the common treatment options that are out there, not everyone is aware of them. And while it is very important for their doctor to provide that information, sometimes the patient doesn't know what questions to be asked or how to ask them that can create those conversations. So being a patient advisor has really opened the door so that patients can get more care from specialists in asthma and allergy, from specialists that cover those medications, those fields, from not just their doctor, but their respiratory care therapist, from their nurses, from their nurse practitioners, because asthma is a really team-centered issue where there's so many different conversations when it comes to the treatment options, prevention, control. And my part of being a patient advisor really proves that we need to have more communication and conversation. Because sometimes when we talk to patients, they tell us, oh, we know these information about, oh, I know what my asthma is, I know how to treat it, but they don't know how to properly take their medication. They don't know how to properly perform their therapies, which is sometimes a conversation that they would have more with the nurse, the respiratory care therapist, or the physician assistants that work with them. So it's creating the communication and that dialogue. And that's what I found being important as a patient advisor.
What tools have you found that work best in terms of, you're talking about language and culture? What have you been able to really key into that you found most useful?
So one of the things I found most useful, and especially in the Hispanic population, is making sure we have things translated, having our flyers, our information in Spanish as well. Because oftentimes we would give, in the past, we would give people information booklets in English, and they would rely on someone else to translate it, or they would just get rid of it. But making sure that we have everything to include in Spanish so that they can understand it in words that are easy for them to comprehend made a huge difference. And it also created a dialogue. Since we were speaking to people in their language, it was easier to make sure that they didn't have any questions, any concerns, as opposed to what I had seen some people would do is if you would ask them questions in English, they would just say, yes, yes, oh no, I'm good, I have no questions. But oftentimes, because of that language barrier, there wasn't that back and forth communication. And for those of you who have asthma, over time, you kind of realize that asthma is very tailored to you when it comes to our medications, our triggers, what we have issues with asthma. I'm an asthmatic myself. And we need to have that conversation with our providers, our healthcare team, to know how to better manage our asthma. So having everything translated to Spanish or their language made a huge impact.
I thoroughly agree. And I think that we have to do a lot more of that in real time, not wait for the translation, but really, and also advocates like yourself that come in with the competence and the language to engage people. I want to thank you. It's a very interesting listening to you and listening to your work. So I have one question for Alex, who's also a project advisory group patient advisor in particular. And that's something that we see a lot, and we see it a lot with patients that are newly diagnosed, with children, and with Latinos who feel that asthma is an episodic occasion. It is something that I'm going to have el asma or fatiga. And I have this either home remedy or somebody sent me something or a doctor that promised me that's going to cure my asthma. So we're always thinking in terms of asthma is something that's just going to happen to me. And all of a sudden I have this ataque de asthma and I have no way to control it. And by the way, I'm trying to get rid of it. It's not going to be a lifelong situation. So I want to pose that to Alex and see how he would like to address that challenge, particularly a very interesting one and common one in Latinos.
Yeah, well, I would like first to introduce myself. My name is Alex. I am from Puerto Rico. And yeah, that's a very good concept. And I think that every patient, me including myself, will pass through that process. And we have to learn that asthma, it's something that we have it forever. Something that it doesn't have any cure. So yeah, I think it's a challenging concept, definitely. And to overcome it, it's hard. Like, for example, I have been asthma my whole life since I was a child. So as a kid and as a teenager and as a young adult, that actually was the way I was treating my asthma. And that definitely doesn't work at all in the treatment management. So I struggle a lot treating my asthma, and that affected my daily living, my daily activities constantly, and that definitely doesn't work. So until my mid-20s, it's when I actually take more power and more engagement and more adherence to the treatment, and it actually worked and improved my asthma, and it changed my life. I got a more active lifestyle. I go out a lot more, and it's just because I maintain it constantly. I used to carry around my albuterol, my rescue inhaler all the time since when I was a child, and that doesn't show up exactly. That doesn't show up that I have my asthma control. In the contrary, it shows that my asthma totally was all the way around. It was actually controlling my life instead of me controlling the asthma. And I like this quote that I use a lot, and I keep it with me. It says that we cannot control asthma, and sometimes asthma controls our life, and that's okay. Yes, but definitely we can diminish the way that asthma controls our life. And in general, I would say that since that moment, my life changed. And I don't know if I answered correctly, completed the answer. I don't know if you have more answers, more question for me.
Well, the correct answer is your answer. It's not my answer.
Oh, okay.
Your experience, absolutely.
Yeah.
One of the things we did in New York, and just to speak to what you're saying, is when we started our asthma campaigns many, many years ago, I was involved. We had posters, and the posters would say in Spanish, "Yo tengo asma, pero el asma no me tiene a mí." I have asthma, but asthma doesn't have me. And it really, in my experience, it's been that to get people to the step that this is a chronic condition, but a manageable one, that our goal is to go to school, to enjoy your life, to participate, and to not be limited by your asthma. That's your goal. How you get there? There are many ways. But really, thank you. I think that's exactly what we needed to hear, that it's not episodic, and it's something that we can, with good care, as Megan was talking about, especially in children, we can get there, and in your experience. So I want to thank you all. I think this has been a great session to moderate. You've all been able to share very candidly a lot of very personal things. So I appreciate that. Les aprecio todo a ustedes, compartimiento, la forma que han compartido sus experiencias y sus inquietudes. So I want to turn it over back to Mary, I think, because I think that's where we are right now. So
yes, well, Dr. Flores and panel, you guys are so inspiring. That was wonderful. Thank you all for sharing your stories and your experiences. And it was just great to hear from all of you. So I just have, I was looking to see if there were any more questions that had come in so that we could answer some of those. But I'm not seeing anything. I think we asked those questions in the in the middle there, so that kind of covered that. But if you do have any questions after the session, just email us and let us know, and we'll get back with you. So for the last slide, I want to thank you all for participating today and remind you to please join us on January the 6th, 2022. I get to say that for the first time, as we continue our conversations about asthma, COVID-19, and the questions that you want answered. And then the rest of this slide just has some information about, one is a study that we have with the Precision AirQ Asthma Study that also includes the telehealth coaching sessions, and that we are enrolling through the end of December. So if you're interested in that, jump online and find out about it, or contact me. And then you can also sign up with our asthma telehealth trusted, Not One More Life Trusted Messenger program. And that's with certified asthma coaches to help you learn more about your asthma. And that is all free to you. So please, if you're having issues managing your asthma, or you just want to learn more about it, we have that to offer you. We also have an it's called Asthma 360 registry, and you can find that at our website as well. And something that was mentioned during the presentation today was having materials and education materials that are in Spanish, and we do have those on our website as well. So again, thank you all for joining us. Until next month, we at Allergy and Asthma Network wish you all a blessed and happy holiday.
Thank you all.